An outbreak of a novel coronavirus, given the designation of 2019 novel coronavirus, started around mid-December 2019 in the city of Wuhan in central China, when an emerging cluster of people contracted pneumonia with no clear cause. A majority of the earliest cases were directly associated with stallholders who worked at the Huanan seafood wholesale market, which also sold live animals and game meat, though the exact origin of the virus has not been determined. Chinese scientists isolated a new strain of coronavirus which has been found to be at least 70% similar in genome sequence to SARS coronavirus. With the development of a specific diagnostic PCR test for detecting the infection, a number of cases were confirmed in people directly linked to the market and in those who were not directly associated with it. There is evidence of human-to-human transmission. Coronaviruses are a group of viruses that cause diseases in mammals and birds that include diarrhea in cows and pigs, and upper respiratory disease in chickens. In humans, the virus causes respiratory infections, which are often mild, but are potentially lethal. There are no vaccines or antiviral drugs that are approved for prevention or treatment. Coronaviruses were first identified in the 1960s, but we don't know where they come from. They get their name from their crown-like shape. The earliest ones discovered were infectious bronchitis virus in chickens and two viruses from the nasal cavities of human patients with the common cold that were subsequently named human coronavirus 229E and human coronavirus OC43. Other members of this family have since been identified. Most of these have been involved in serious respiratory tract infections. In 2003, following the outbreak of severe acute respiratory syndrome, SARS, which had begun the prior year in Asia, and secondary cases elsewhere in the world, the World Health Organization, WHO, issued a press release stating that a novel coronavirus identified by a number of laboratories was the causative agent for SARS. The virus was officially named the SARS coronavirus. Over 8,000 people were infected, about 10% of whom died. Currently there are 7 known strains of coronaviruses that infect humans. Coronaviruses cause colds with major symptoms, for example fever, throat swollen adenoids, in humans primarily in the winter and early spring seasons. Coronaviruses can cause pneumonia, either direct viral pneumonia or a secondary bacterial pneumonia, and bronchitis, either direct viral bronchitis or a secondary bacterial bronchitis. Human coronaviruses are difficult to grow in the laboratory. China on Sunday morning announced 15 more deaths from the new coronavirus, including one in Shanghai, the first reported so far in the metropolis. 13 more deaths were also announced in Hubei province, where the outbreak began, and one was announced in Henan province. The latest deaths brought the toll in China to 56. Across the country, 688 cases of the new virus were diagnosed on Saturday, the government said early Sunday. That brings the total number of confirmed cases to 1,975. How to prevent coronavirus? There isn't any vaccine yet for coronavirus. Isolation and quarantine remain the very best methods to prevent its spread. Other preventative measures include 1. Quarantine. 2. Hand washing. 3. Disinfection of surfaces for fomites. 4. Wearing a surgical mask. 5. Avoiding exposure to bodily fluids. 6. Washing the personal items of someone using the virus in hot water and soap. Eating utensils, dishes, bedding, etc. 7. Keeping youngsters with symptoms home from school. 8. Simple hygiene measures. 9. Isolating oneself wherever possible to minimize the likelihood of transmission from the virus.